Hi everybody, hope everybody's keeping well, keeping safe. I thought I'd do another video since I haven't done any for a couple of months. Before I begin, I just thought I'd give a shout out to my son. He's studying nutrition at university, and he has a page called BS Strickland Nutrition. Go along, visit the page. I'll leave the link to it in the description box below, so you can click on it and go and have a look. I mean, he's helped me lose a stone over about 14, 16 months, steadily, and also helped me to keep the biggest part of my muscle tissue that I gained through training. So no, he's worth a visit. Go along. BSc Strickland Nutrition. Like I say, I will leave a link. I mean, he's got quite a lot of experience. He's worked in the community. He's worked in hospitals. He does projects at university. He's won awards. So he does know his stuff. He does know what he's talking about. And he studies science. He studies journals. Up to date. So he's well informed. So yeah, that's BSc Strickland Nutrition. So anyway, I thought I'd do a video. I thought I'd share one of my presentations. I did share one a few months back on alcohol addiction. This one's on it's around borderline personality, which is quite close to me because I have that condition. So I thought I'd just run through. If it may be of use to somebody out there, I don't know. But it's a shame to waste it. I thought I'd just run through this presentation quickly. Somebody might get something from it, hopefully. Shame to waste it. It's it's not much use to me anymore now. So the name of the presentation it's around schema-focused therapy. So the title is Schema-focused Therapy Effective for Borderline Personality Disorder, BPD. You will see me keep looking to my right, your left maybe, because I'm reading off there's a computer here to my right hand side, so I'm reading off some slides. But yeah, so the title is, we'll go through it now, is Schema-focused Therapy Effective for Borderline Personality Disorder, BPD? So the aim and purpose of the presentation was to investigate the effectiveness of schema-focused therapy for the treatment of BPD. Examine the process of locating research articles, assess the findings of the papers, discuss the strengths and limitations of the papers, and any recommendations, an analysis of ethical issues, and review how research informs counselling and psychotherapy. In the conclusion, the course I was on at university was counselling and psychotherapy studies. So this was part of the mental health module. No, it was a research module. So therefore, I'll go through it now. Right, the search compilation which I used was Discovery, which is a university-based platform. I typed the word schema-focused therapy, or SFT, borderline personality disorder, and treatment or therapy. PsycInfo, which again, these are databases that I could access by university. PsycInfo, schema-focused therapy on borderline personality disorder, or BPD, and treatment or intervention of therapy. The Discovery has put schema-focused therapy or SFT and borderline personality disorder and research, and UK, United Kingdom, Britain or England. Psych articles and PEP archives, and no journals was older than 2000 and from 2012. If you're not at university, you could probably access some of these research articles through Google Scholar, and there are some free sites out there as well to access journals. Right, changes in schemas. The first one I covered was changes in schemas of patients with severe borderline personality disorder. The ULU BPD study, I think it was, I don't know if it's Swedish or Norwegian or something like that. It was Norwegian, I think. The aim was to discover if integrated if an integrated treatment of schema-focused therapy, SFT, and dialectical behavioural therapy, TBT, could be more productive than treatment as usual, TAU, for borderline personality patients to integrate therapeutic influences from 2 different therapies to generate a more viable, successful therapy which requires minimal training for therapists. So basically they're going to combine schema-focused therapy along with borderline dialectical behavioural therapy, which is well renowned for treating borderline personality disorder. So these was going to mix the two, combine the two. Participants, it involves 112 patients screened, 71 randomised. All patients met the criteria for BPD as per ICD-10, which is the diagnostic manual that the UK use, and it's the DSM-5. That's the other one. I think that's used in the States. Additional criteria: patients' ages would need to be at least 20 years old with severe BPD or previous unsuccessful attempts at treatment. Randomisation was performed suitably to a 1:2 proportion, 24 individuals randomised to the community treatment by expert CTBE and 47 individuals to the treatment as usual group, TAU. Methods: the community treatment by experts involved weekly independent therapy and psycho-educative group sessions with telephone communication with a private therapist in normal office hours. Individual therapy was supplied for 12 months, meetings lasting between 45 and 60 minutes, which is the norm for therapy sessions. Treatment and usual individuals received treatment in hand with the ULU mental health care services, including work groups, weekly psychotherapy and periodic GP calls for drug management. Results that was found were the community treatment by experts group displayed 8 out of 18 schemas had shown depletion, with p-values varying from 0.001 and 0.035 relevance between schema variables. Treatment as usual group showed no relevance in schema reduction between measurements. Strengths and limitations of that paper were strengths were individual fulfill strict selection criteria. That's Bloom et al. 2000 referenced. Schemas were measured utilising Young's schema questionnaire, which assists trait-like features. Authors reviewed past research and found a gap in the literature, which is always key, is especially when you're reviewing other literature, is to find a gap in the literature, because there's an area to focus on. Provide an unbiased the randomised control trial would provide an unbiased evaluation of research outcomes. Limitations: there were some limitations. Little research carried out to compare effectiveness of schema-focused therapy and other therapies for BPD. For example, maybe CBT or something like that. It was only used with DBT, dialectical behavioural therapy. A small sample size of Small sample size of 45 participants completing the Young schema questionnaire. Therefore, the risk of biasness. It's always the case with a questionnaire, because at the end of the day, it's either biasness or are they going to tell the truth on the? Are they going to put, depending maybe how they feel one day, are they going to be genuine when they fill the questionnaire out? Small samples of questionnaire for risk bias. Limited reliability of completing questionnaires at home. That's what I've just said. Majority of patients male, so unreliable in relation to females, and there's quite a high population of females that do have borderline, so that is a big limitation. I think there's more females than males actually have borderline personality disorder. Offers limited understanding of the characteristics of borderline personality disorder. I'm getting mixed up with all the recommendations: a larger sample size, further research to include a wider demographic range, further studies to overcome limitations, and further research for schema-focused therapy effectiveness without the combination of DBT, which would be useful. Ethical issues, how this informs counselling and psychotherapy. Well, ethical issues it was covered by and permitted by the Oulu University, 2009. No follow-up aftercare for patients. So they got ethical approval, but there was no follow-up, which, in a sense, want to see how individuals feel and are coping thereafter. And again, it would further add to research findings. The risk of further trauma to participants, which I've just said. How does this inform? It gives an indication that combined model of has a positive outcome in relation to schemas. The treatment model can be used in public mental health settings by existing therapists. Minimal training required, which I'm a bit unsure of myself, to be honest. I should have maybe questioned that as when I did this research presentation. Right, the second one I covered three. The second one I covered was a systematic review of evidence-based schema therapy, Masley et al. 2012. The aim was to analyse the evidence and support for schema therapy and offer advice for further research. There's always room for research, I would say. Participants, all individuals were 18 years old. No individuals with psychosis, severe drug use or serious Axis 1 disorder permitted. Method: to examine the treatment evidence for schema therapy described by Jeffrey Young. Study design and exploration of randomised controlled trials, RCTs, and controlled trials and uncontrolled trials, UT. Search procedure, schema therapy or schema-focused therapy, all electronic databases were searched until 2011. Results: from 12 studies, 4 were considered to be examining the effectiveness of borderline personality disorder, which is BPD. Study 1, Farrell, Shaw and Webber, 2009. Randomised control trial, outcome measure applying assessment of functioning scale pre and post treatment. Effect size applying pooled standard deviations ranging from 4.45 and 1.17 significant, which is significant, and 0.14 and 0.35, which is small. Study 2 was Geeson and Blue et al. 2006, a randomised control trial. Outcome measure using borderline personality disorder severity index 4th version. Effect size using Cohen's D rating scale from 0.43 small, which equals small, and D equals 1.303, which is large. A large effect size. Study 3, Nodort et al. 2009, which is a randomised control trial. Outcome measures using borderline personality disorder severity index 4th version. Effect size using Cohen's D for reduction of BPD SI, which was D equals 1.55, which was significant. Getting mixed up with my words. And the 4th study was Nordhall and Neisater 2005, if I pronounced their words right. Case series design outcome measure using Beck Depression Inventory, Beck Anxiety Inventory and Young Schema Questionnaire. Effect size using Cohen's D pre-treatment to follow up 1.8 to 2.9, which was significant. Strengths and limitations of that study. Strengths were systematic examination provides evidential support. That's Bond and Bond et al. That's referenced by Bond et al. Meta-analysis provides a superior correlation between different studies than a single study. The researchers examined papers that used rating scales to calculate effect size for the BPD studies, which are considered to be more robust. That's Fried et al. 2016. Everything on here is referenced. I'm not going to read them all out. It'll take forever. A critical assessment of previous research. That's Gold et al. Limitations. 4 out of 12 study represents a small sample size, therefore results collected could be misleading. That's McKinnon et al. So he agrees that what I suggested, that was 4 out of 12 studies, is, represents a small sample size, and I had to reference that with McKinnon et al. Meta-analysis takes time, lacks scientific trustworthiness. Some of the studies for BPD were studies ranging from 2005 to 2008, therefore quite old, although not really old, but they're quite old in relation to, I was trying to keep in within a 5-year window. As much up-to-date research as possible, really. But research is research at the end of the day. Could miss suitable research. I don't know what I quite meant with that. Recommendations: a review of more recent studies, review studies that only include BPD participants, and review studies with a wider demographic context. So basically what they've done is a systematic review. They've taken these these people have taken other research and reviewed it, basically. Ethical issues and how this informs counselling and psychotherapy. Ethical agreement is not needed for a systematic examination of literature because you're reviewing other papers, so you're not using actual individuals. How does this inform us? Well, it informs us therapists. Informs therapists the effectiveness of schema therapy. Focused therapy informs us that there is limited research for schema-focused therapy and its effectiveness of a BPD. Gives way to further research into the effectiveness of schema-focused therapy for BPD. Right, I think it's just... Right, and the third study I covered was the blending of evidence-based protocols in the treatment of borderline personality disorder, a case study. This was Lovelace et al. 2016, so a couple of years ago. The aim was a case study to demonstrate the combined approach. So this is using an individual list. So a case study to demonstrate a combined approach to the treatment of borderline personality disorder, BPD, incorporating the schema-focused therapy, SFT, and dialectical behavioural therapy, DBT. Participant, so there's only one. A 34-year-old biracial woman of Caucasian and Hispanic descent. The assessment was carried out, an examination of participant history, reliability and validity, outcome questionnaire 45.2, Lambert et al. Beck depression inventory 2, Beck's and Steer 1993, Beck and Steer Brown 1996, personality assessment inventory PIA, and BPD selection of structural clinical interview. The method and results, and that's that research onto this individual. 30 therapy sessions, schema-focused therapy guided using schema-focused therapy. SFT using guided using schema-focused therapy, got that mixed up. A practitioner's guide, Young et al. 2003. DBT using the dialectical behavioural therapy skills workbook. Treatment recorded via the questionnaire Q45.2 and a self-report. Schemas verified using the Young Schemas questionnaire, plus various DBT concepts also used. Results pre-treatment. Q questionnaire 45.2, 123. BD1, Beck's depression inventory, isn't it that? I can't remember what the Q1 was. Is 14, so the BDI, Beck's depression inventory, came out at 14, sorry, and the Beck's anxiety inventory, I think it was, came at 31. Results post-treatment. Q 45.2 equals 14, Beck's depression inventory 0, and Beck's anxiety inventory, I think it was that, was it? Anxiety or... Oh, it's the validity, the outcome questionnaire is the OQ 45.2, and oh god, yeah, it's the personality assessment in inventory. Yeah, it came out. So the post results were the outcome questionnaire 45.2 was 14, Beck's depression inventory, and the personality assessment inventory came out at 1. Self-report improved quality of life, that was the outcome of that. I messed that one up, I think, there, reading that out, but I've not looked at this for over a year, so I'm not that familiar now. Strengths and limitations. Strengths: case studies produce qualitative, thorough observation data, and that's backed up by Unicorn et al. 2015. It probes subjective experiences, so it really digs in. It focuses in rather than a group. It focuses in on one individual. However, obviously a small sample size, so it only, but it does allow researchers to access, in more depth, I guess. Probe subjective experiences. Solly 2015 supplies an impressive examination of the individual's psychological difficulties. That's what I mean. It homes in on one person, really, as much as it's, I think it's good research, but one person doesn't represent everybody else, does it? But I suppose it gives researchers an indication, that an in-depth look at borderline personality disorder and whatever treatment people are going to research. Opens up for further research. Limitations: possibility of researcher bias. Yeah, the researcher can be biased towards his own research. A limited sample size, only one female and one gender. That's Ruddy 2013. Time consuming and difficult to reproduce. Well, that's the thing. If it's only one person, the trustworthiness is open to debate. So that means that's possibly the trustworthiness from the scientific evidence and trustworthiness from the individual in question as well. Recommendations: further research including a wider range of gender and cultural background, more research into schema-focused therapy without DBT combination, which was like the first research study I covered, research into challenges of combined research. And I think that is the end. Oh no, ethical issues and how this informs counselling and psychotherapy. Light's gone out on my computer again. Ethical agreement is not stated, which is a bit of a letdown, really, because ethical approval, when you're certainly using individuals, especially individuals that have got serious mental health, conditions, you need to be gaining ethical approval. It's pretty important, really. So that's a really big letdown on that paper, that research, that study. No aftercare or follow-up or assessment implemented, which is pretty shabby as well. That's pretty. I mean, at the end of the day, they've delved into this. I mean, she's obviously agreed, but they've delved into, into a illness and not followed up, I think is quite shocking, really. No acknowledgement of consent mentioned, so I mean, I just said she must have consented, but there's nothing documented, so that's worrying. Research was supervised by clinical, so there was a clinical psychologist on hand, which which research was supervised by a licensed clinical psychologist. How it informs us suggests schema-focused therapy works well combined with DBT, which it seemingly does. I know DBT is the one for it was designed specifically for BPD patients. Informs us schema-focused therapy is effective in helping the client understand how symptomology has developed and maintained. It informs therapists the importance of the therapeutic alliance in the implementation of schema-focused therapy. Well, the therapeutic alliance is really important between clients and therapist. Conclusion to this, if I've not bored you by this stage, more research required into how schema-focused therapy affects outcomes without combining DBT. I even sound fed up now, but more research required. But I think there's always more research required. I think more research the better, especially when it comes to talking therapies, which these are. I think, and bigger sample sizes too, across the board. Maybe for longer too. I know research takes time, but especially when it comes to therapy, it's going to. But I think in the long run, you may get some better findings. More robust findings. Research using a broader demographic group, which again I think is important. Schema focus is shown to be effective alongside DBT, which we've found. Therapists may require minimal training to deliver schema focused therapy. Maybe to deliver the therapy, but you're still dealing with another person that's maybe it will have emotional issues. So therapists obviously will be trained to deal with that. So what they're saying really, what it's saying is to deliver the schema focused therapy, minimal training to So I don't like the word minimal, but that's what it found. Schema focused therapy could be cost effective, especially as BPD is usually a complex and unpredictable disorder. That's Shannon et al. 2015. Who agrees with me on that one. Cost effective, so it's going to be a winner, especially in this present climate. And again, it boils down to money, doesn't it? I mean, it shouldn't do really, but especially for it's usually BPD is people who do suffer with BPD will understand it is quite complex, very complex. You can have emotional irregulations within the hour, throughout the days. So therefore, but allegedly, according to this research that I did, I'm not sure how much of that you'd have understood. It's the first time I've looked at that paper, that research presentation, since I think I shut it down after I'd done the presentation at uni. So I was a little bit unfamiliar with it really, but I hope at the end of the day, somebody may get something from it. What I will do is I can upload the actual presentation in like film format. I've got one of those, so I could maybe put that up there, and maybe you could look through yourself, and maybe correct me if I've got things wrong as I've read it out. But there was a couple of areas that I got stuck with on a couple of the slides, but nevertheless, I think I've got through it. But at the end of the day, there is the good thing about it is there is research being done into the treatment of BPD, borderline personality disorders. I think, with such a complex as most mental health conditions are, it's good the fact that BPD, is put forward for research, as I think all mental health conditions. I think to try and understand people's conditions. I mean, we can never fully understand because we're not that individual, but I suppose, on an empathy side, we can at least try to understand and at least try and see the world from their perspective. And if we can combine that with research, science-based research really, and more and more research, maybe we can come up with something where we don't need to, as in my case, throw pills at patients. Maybe we can deal with this, in a more therapeutic manner. Like I say, if anybody is interested in it, I hope it's come across fairly clear. If it's not, please leave a comment and I'll go back to it and see if I can make a better job of it. Really, I mean, like I say, it's the first time I looked at that presentation since I switched it off when I did the presentation at uni at the beginning of last year. So I could have looked at it before I decided to do this, but I thought it'd be more fun if I've not seen it for over a year. But see, I mean, like I say, I will upload the. There's like a film. It's done. I don't think I did it with Google or something like that. On my laptop at the time, it's like a film with the slides, so I could maybe upload that, and then you can go through it yourselves then, because there's loads of references on there. I wasn't gonna. There's a reference list at the bottom here. There's about 50 or 60 references. I wasn't going to read all them out. I don't think I've got enough battery on my phone anyway to do it. But anyway, that is basically, is schema-focused therapy effective for borderline personality disorder? Well, it seems to be, especially when it's combined with dialectical behavioural therapy, DBT, it seems to be effective. As always, more research needed, more thorough research, more research into wider demographics, age groups, ethnicities, all sorts. Long way to go, but at least some's been done. Anyway, like I said at the beginning of the video, give a shout out to my son's nutrition page. I'll leave a link in the description. It's BSc Strickland Nutrition. And thank you if you've listened this far. I doubt anybody will have done, but it gives me camera time, I guess. But anyway, if anybody can make use of that, great. But if not, anyway, I'll be back soon. I'll do something else. Maybe leave a comment in the comments as to what you want me to look up, or do something on. I like to talk around mental health and things like that, and addictions and substance misuse, anything really. I'm not bothered. I'll talk about anything, fish, animals, whatever. Anyway, that's me. I've rambled on enough now, so I'll speak to you soon.